Good afternoon, and thank you for joining us for this community briefing. Joining me again is interpreter Francis Beaurivage. Thank you, Francis, so much for providing your services. And we want to remind all of you that a great deal of information about public health and the pandemic in Lincoln is available at our website, covid19.lincoln.ne.gov. There you will find our COVID-19 risk dial, a tool to help our residents know the steps that they can take to protect themselves and the health of everyone in our community. That risk dial provides a visual, color-coded forecast of risk in Lincoln and Lancaster County. And we update that dial weekly, and last Friday did so, upgrading our status to yellow, which means that the risk of spread of COVID-19 is moderate. And while this certainly represents positive progress for our community, we continue to offer words of caution. We all remain at risk of contracting the coronavirus anytime we're out among other people. It's extremely important that we continue to employ proven strategies that prevent the spread of the virus. Continue to stay at home most of the time. Stay 6 feet away, at least 6 feet away from others when you're outside the home. Wear a face covering and wash your hands frequently. This is how we will continue to protect ourselves, our family, and our neighbors from contracting the disease COVID-19. Moving on to our public health situation report. Today in Lincoln, we have had an additional 4 individuals test positive for COVID-19. That brings the total number of lab-confirmed cases in Lincoln to 1,376. Our total recoveries identified to date is up from 267 yesterday to 323 today. Again, we define recovery as an individual previously diagnosed with a lab-confirmed case of COVID-19 who has not experienced symptoms for the past 28 days. Lincoln had few cases of the disease reported prior to the end of April. We do anticipate additional recoveries to be reported in the coming weeks as that 28-day marker is reached by more individuals who contracted the virus in May. Here with more on the latest case investigations is Health Department Director Pat Lopez.
Thank you, Mayor. The Health Department continues to use local and regional data from the previous few weeks to determine what the risk of spread of COVID-19 is in our community. As the Mayor said, we use the data to move our COVID-19 risk dial down to the yellow level on Friday. The total number of new cases reported last week, May 31st through June 6th, was 146. That's down from 164 reported the previous week ending May 30th, and down from the 250 the week ending May 23rd. The overall positivity rate has also dropped for 3 consecutive weeks, from 9.2% on May 15th to 7.4% on Friday. Today, the rate is down to 7.3%. In comparison, the state is at 12.8%, and the national rate is at 12%. Overall, our local hospital capacity remains strong. The number of COVID-19 patients in our Lincoln hospitals has dropped from a high of 47 patients on May 12 to 28 today. 16 of those are Lancaster County residents and 12 are from outside the county. The number of patients on ventilators is now 7, 5 of whom are from Lancaster County and 2 from outside the county. Yesterday, Nebraska Health and Human Services reported there are 176 individuals hospitalized with COVID-19 across the state. We have seen a decline in the number of people being tested, but local testing capacity continues to be good. Nearly 19,000 individuals have now been tested in Lancaster County. Since Friday, 632 tests were completed through the hospitals and drive-through testing sites. Test Nebraska completed just over 1,000 tests in Lincoln last week. Test Nebraska has also expanded its testing criteria. Testing is now open to anyone ages 15 through 35. Test Nebraska announces its schedule weekly To sign up to get tested for COVID-19, start by contacting your doctor or filling out a risk assessment at chihealth.com, bryanhealth.com, or testnebraska.com. We continue to identify and monitor potential clusters to minimize additional spread of the virus. In Lancaster County, 66% of the potential clusters are cases connected to meat processing facilities. Our COVID risk dial is a very useful tool for public awareness. In fact, we are now working with other local health departments to help them adapt the use of the risk dial to their communities. We are also looking for other ways the dial can be used. We have been working with local school districts on how they can use the risk dial to help inform them of local risk and plans for school operations. We are also have developed specific guidance for businesses on how to incorporate strategies to protect their employees and customers and prevent the virus from spreading. Businesses continue to be incredibly receptive. The health department has received over 1,200 calls since March 23rd related to the directed health measure. This has helped ensure that reasonable and effective guidance has been provided. We continue to work with businesses and private individuals to review safety plans for events. Currently, any indoor or outdoor venue that plans events for 500 or more people must submit a reopening plan to the health department. To make this a simple process, an event plan application form is available on the city's COVID-19 webpage under Business Resources. Once a plan is submitted, the health department staff reviews it and works with organizers on any changes that are needed to ensure that all workers and attendees are safe at the events. The electronic form essentially helps these venues write their own event safety plan. So far, the health department has received 10 plans for review. And finally today, I want to remind everyone that anyone can get and spread COVID-19. We all need to continue or limit our interactions with people outside of our own households. And we should all assume that there is risk of exposure anytime we are out in a public space where other people are present.
Thank you, Director Lopez. We all need to remember that the virus still has the potential to increase its impact in Lincoln. As the directed health measure restrictions ease somewhat, our residents are also becoming more active. And as we begin to host small gatherings of family and friends and attend small outdoor events, there will be an increased potential for exposure opportunities in our community. We all need to continue to support one another and continue to practice physical distancing, wearing face masks when around others, and washing our hands regularly. We certainly want our progress to continue forward and not have to go backwards. At this point, we're going to turn to the topic related to the pandemic, of course, our Economic Recovery Task Force that I announced on May 27th. The recent calls for racial justice and equality, and the clear evidence that COVID-19 has had a disproportionate impact on communities of color have both drawn attention to the moral, social, physical, and economic costs of systemic inequity. That is why inclusivity was incorporated at the outset into the mission of the Economic Recovery Task Force. The task force's charge is to develop data-driven, locally informed strategies for supporting local businesses and employment as the local economy begins to recover from COVID-19, while fostering public health, inclusivity, and resilience. With that overarching goal in mind, the task force will develop a report with recommended strategies for supporting local businesses in adapting their business models and retaining and supporting their workforces, supporting local workforce development and employment, and supporting local sectors of the economy and community that have been negatively impacted by the pandemic and that contribute to our community's quality of life and competitive advantage. This economic recovery work lies at the intersection of all three of the initiatives that my administration announced last fall: Lincoln Forward, One Lincoln, and Resilient Lincoln. Lincoln Forward, which encompasses the city's economic and workforce development efforts, is about growing Lincoln's prosperity and quality of life. One Lincoln, which encompasses the city's equity, diversity, and inclusion efforts, is about ensuring that every individual has the opportunity to access that prosperity and quality of life. And Resilient Lincoln, which encompasses the city's climate and infrastructure resilience efforts, is about developing Lincoln's capacity to endure challenges to that which we hold essential and dear. In the midst of this economic crisis, resilience for Lincoln has taken on new and added meaning. For purposes of this task force, it might mean that businesses support their employees' personal resiliency by offering more mental health and wellness services. For businesses and nonprofits, it might mean adapting business models to foster more resilience at the organizational level, such as by moving more services online, or relying on more local supply chains, which will help the organizations better weather future shocks. Just as each of us has a part to play in fostering our community's public health and inclusivity, each of us has a part to play in fostering our collective resiliency. Ultimately, the alignment of our economic recovery efforts with our commitment to making Lincoln more inclusive and resilient is both necessary and fundamental to ensuring that our city's recovery is robust, strategic, and shared by all. With that, I am pleased to announce the members of the task force who will be engaging in this important work. The task force members are Angie Muehlheisen, President and CEO of Union Bank and Trust, who will be co-chairing this effort; Ava Thomas, President and Publisher of the Lincoln Journal-Star, who also will be co-chairing this effort; Marco Barker, PhD, Vice Chancellor for Diversity and Inclusion with the University of Nebraska, Lincoln; Matt Bavogian, owner of Onyx Piercing Studio and a member of the Legislation and Regulatory Affairs Committee of the Association of Professional Piercers; Wendy Birdsall, President of the Lincoln Chamber of Commerce and the Lincoln Partnership for Economic Development; Quentin Brown, Executive Director for Educare Lincoln; William Santani, CEO of Mapes Industries, Incorporated; John Krogan, President of the Seniors Foundation Board of Directors and Executive Director of Emmanuel's The Landing at Williamsburg Village; Maribel Cruz, PhD, Director of Leadership Consulting with Talent Plus, Incorporated and President-elect of the Angels Theater Company Board of Directors; Shannon Harner, President and CEO of Home Services Nebraska; Jasmine Kingsley, Senior Vice President of Legal and People at Huddle; Jose Lemus, Community Organizer with Civic Nebraska and Collective Impact Lincoln; Susan Martin, President and Secretary-Treasurer of the Nebraska State AFL-CIO; Dan Marvin, Director of our City of Lincoln's Urban Development Department; Kim Russell, Founder and CEO of Russell Advisors and retired CEO of Bryan Health; Nader Sepapur, owner of Yaya's Pizza and Beer, Mars and Amumanu Ramen Bar; Bud Seinhorst, President and CEO of the Lincoln Independent Business Association; and Corey Sampson Vokun, Vice President of Sampson Construction Company. I want to thank all of these dedicated individuals who have offered their service as task force members, and I really appreciate what they will bring, the various perspectives and way that they will inform this community-wide effort to move our community forward. Finally, we have been sharing art from children on Tuesdays as part of the Sunshine Kids for Seniors project. Aging Partners is helping to connect children with our homebound seniors by sending notes and artwork. And if your family would like to participate, you may send your scanned notes and artwork to sunshinekids@lincoln.ne.gov. Just please limit it to a first name only on the kids' artwork, though. All right, and with that, we'd like to open it up to questions from the media.
Mayor, this is Bill with 1011.
Hi, Bill. Hi, Bill.
We're getting a lot of questions about playgrounds in the city. I know pools are opening up a week from today. Have you given any thought to playgrounds at city parks?
Yes, we have. That as a question that we've had under discussion both with the Parks Director and our Health Director. The CDC is informing our work on this, and I'll let Pat Lopez come up and give you the latest CDC guidance on playgrounds.
Great question, Bill. We actually, as the mayor said, been talking about that and looking forward to that possibility, but CDC has continued to issue guidance that that's an area where potential high-risk exposure is. But believe me, we're monitoring that constantly because we'd like to see our youth be able to get out there and our children and enjoy that activity. And Bill, I'm going to take a moment to say something else. When I was sharing my notes today, my comments, I said 66% of our cases were related to the meat processing plant, and it's really 33.4% of our cases are related to that, but almost 66% of our cases have some form of a cluster, meaning that there's 4 more cases involved with them.
Thank you, Pat.
Thank
Director
you.
Lopez,
Yes.
Riley from the Journal Star. What have you guys discovered any new cases related to Smithfield and Crete, and or could you speak to the trend there? Have they slowed down, locally, or have they stopped finding cases that are associated with that cluster?
Smithfield, the actual plant in Crete has been pretty stable. We've continued to see maybe 1 or 2 cases, an increase that we're looking at one of the other plants here in Lincoln. But the Crete plant seems to be pretty stable at this time, Riley.
Are there other questions from the media? All right, well, if there are no further questions, we thank you for tuning in to this briefing. We'll be back on Friday at 3:30 with more about COVID-19 and how we can continue to prevent the spread and to take care of each other and protect our community and our loved ones. Thank you.